Prime Minister, thanks. Let's hear from Prit now.
Hi, my name is Preet. I live in St. George area, Kogra. In recent years, I've realized that whenever we have to go for medical visit, we have to pay doctors a gap fee, which is increasing every day. So it's very difficult with current cost of living crisis, every time paying extra gap fee. So I want to ask both of you, what's your plan? Do you want to increase Medicare funding so we won't have to pay extra gap fee? Or is there any way where we can stop doctors to charge us extra?
Prit, thank you.
Well, thanks very much, Prith, for that question. And this is one of my government's priorities. And what we did in last year's budget was we tripled the bulk billing incentive for doctors, the amount that they're paid, for concession card holders, for pensioners and others who go along. That resulted in a 90% rate of bulk billing. Now, we now have another $8.5 billion to triple the incentive for everyone, all 27 million Australians, because we want those bulk billing rates to go up to 90%. On top of that, we have Medicare urgent care clinics. There's one just down the road here in Wentworthville that I've been to with Andrew Charlton, the local member. They have seen 1.3 million Australians. 1/3 of them are under the age of 15, and people can get the care that they need when they need it. In between, if it's not life-threatening, you end up at an emergency department. In between, if your kid breaks their arm or you need urgent assistance but it's not life-threatening, that's the place to go. And that's made an enormous difference. And all you need is this little thing here, Prith. You just need your Medicare card, not your credit card, because Labor created Medicare, will strengthen Medicare, and we'll make sure that in the future we get those bulk billing rates back up to 90%.
Mr Dutton.
Prit, can I just ask, please, it's a great question, but can I just ask, what's your experience? So when you go to the doctor that you talk about with the gap fee, do you have to use just your Medicare card, or do you have to use your credit card as well?
I have to use both, because bulk billing doesn't cover the full charge, so I have to pay $70 or $80 extra.
Yeah. See, I hear that. Thank you very much, and I appreciate it, because yours is the story of literally hundreds of thousands, millions of Australians as well. And I've heard the Prime Minister run this stunt before with the only need your Medicare card. It's not true. Bulk billing rates have reduced under this government, and that's the reality. It's there in black and white. Not only that, the out-of-pocket expenses have increased as well, which is exactly your experience. I want to make sure that we can provide adequate funding, and we've announced almost $9.5 billion now into Medicare and health services in our country. We need to train more GPs, and we've announced $400 million to train more GPs, because we've got an ageing workforce, and it's particularly difficult to get GPs out into the outer metro areas and regional areas as well. So we need to make sure that we've got a system where you can go, particularly in a circumstance where you can't afford to pay with your credit card, or you just don't have the cash available. I don't want you to miss out on going to the doctor. And what we're intent on doing is making sure that we can lift the bulk billing rate so that we can get support to families like yours. Under this government, though, the Medicare campaign continues, but the Prime Minister, if he was being truthful with you, would say to you that, yes, the cost that you're paying out of pocket has increased under this government, and the fact is that bulk billing rates have fallen under Labor, including in this electorate here in Parramatta.
But, Peter, you tried, when you were the Health Minister, you tried to abolish bulk billing by having a fee every time people visit a doctor or every time people visit an emergency department. That's what you did as Health Minister, and when you couldn't get that through, you froze the Medicare rebate, which stayed frozen for 6 years. That's why we are having to deal with this. That's why my government has had to find the $8.5 billion that you've matched. To be fair, you have said you agree with our policy there, but we're repairing what we inherited, which was bulk billing in free fall while the coalition was in government. Well,
again, that is factually incorrect. So I was Health Minister in 2013-14. The bulk billing rate in our country was 84%. It went to 88% by the time we finished government, and the Prime Minister rightly will point out that that includes services over COVID. But it was heading up under us. The fact is that it is now down to 77%.
But Peter, did you try to introduce a charge to get rid of bulk billing?
I'm happy to come to that. So it's now at 77%. The Prime Minister wants you to believe that it's much higher and that it's in freefall. It's not. It wasn't in freefall under our government. And what has happened since the Prime Minister's been in power over the last 3 years, it has come back. Now, doctors that we put into training when I was Health Minister, when Greg Hunt was Health Minister, those doctors have graduated at a record number and are coming into the healthcare system now. We invested into that. Our desire in relation to the whole health system was to make sure that we had a strong general practice, because it's the experience of all of us. When you have young kids or you've got aged parents, you need to be able to have a relationship with the general practice or a doctor that you can go to regularly. You need to be able to make sure that you can get an appointment, which is difficult at the moment. And we were trying, and we will always do our best, and that's why we've supported the funding now to build general practice. I want to see a strong primary care network, because if we do that, we can stop presentations at emergency departments, we can detect earlier cancers, and that's the whole idea of having a strong network of general practice. And under our watch, the bulk billing rate increased. Under this watch, under the Prime Minister's watch, it has gone down. That is in black and white.